Hi, Dr. J here. What's involved in a kidney transplant? Let's learn. The kidneys are on each side of the spine. Each kidney has three connections to the body: the artery, the vein, and the ureter. These have to be reconnected in a transplant. So how do you put in a real kidney? And that's about the size of a fist. The kidneys are placed in the groin, so an incision is made in the lower belly. Under this incision are blood vessels that supply the legs. These blood vessels are called the iliac artery and the iliac vein. The kidney is placed next to these blood vessels. The kidney's artery is connected to the artery. The kidney's vein is connected to the vein. And that leaves the third connection, the ureter, which is connected to the bladder. One question I get is the transplant kidney put in where the normal kidneys are? No, this is not placed in the same location as the kidneys you're born with, which are called the native kidneys. The transplant kidney is placed in the groin because blood vessels and bladder are easier to get to in that spot. Another question I get is, do my kidneys get removed? Although they are not functioning, the native kidneys are not usually hurting anything, so they aren't removed. But there are some special cases. For example, in polycystic kidney disease, the kidneys become very big and may therefore be removed at transplantation or after. This doesn't change where the transplanted kidney goes. And for most patients, the native kidneys are not removed. Kidney failure can also cause hardening of the arteries, and this often results in blockage of the arteries. This affects all arteries represented in red here, including those needed to connect the kidney and those supplying the heart. So what's the implication for kidney transplant surgery? Let's first look at the arteries needed to connect the kidney, the groin or iliac arteries. For a successful kidney, the kidney artery has to be sewn into the iliac artery with a needle that is attached to a suture. The needle represented here, though, is much bigger than what is used for a kidney transplant. This is the more typical needle, except that this is the real size. Difficult to see, right? This is why transplant surgeons routinely wear magnifying glasses to see the teeny needle and sew very precisely. So if the patient's artery becomes hard, it's like sewing to a rock. And as you can imagine, this makes it impossible to sew in a kidney. So we often get a CAT scan to look at these vessels before doing a transplant to make sure that the kidney can in fact be sewn in to this area. So observe this CT scan in the iliac artery, which is encircled. This is a CAT scan in the same patient after some time on dialysis. There is significant damage to the arteries, and this means that the patient is no longer a candidate for a kidney transplant. Obviously, the shorter the dialysis period, the less likely this is to happen, which is an argument in favor of living kidney donation. Also, the hardening of arteries is not inevitable on dialysis. These issues will be discussed in other videos. Let's talk about the heart. The hardening of the arteries can also affect the arteries of the heart. Our heart beats nonstop, so it needs nonstop supply of energy. To supply this, the heart has its own arteries. If one of those arteries has a blockage, though, the heart gets inadequate blood supply, and this can lead to a heart attack. Some patients may have a heart that beats fine, even with the blockage. Maybe the other vessels are compensating, or the patient doesn't stress the heart too much. So it hasn't caused a problem yet. But what happens if they undergo a kidney transplant? A kidney transplant is major surgery. So this is an extra stress for the heart, meaning that the heart needs increased blood supply, which can be too much for a heart with blockages that limit the blood supply, leading to a heart attack. Obviously, a heart attack during surgery is a disaster. So how can we tell which hearts have blockages that would make surgery dangerous? The answer is to do a stress test. This is a very gradual increase of stress under monitoring. This is like the stress of surgery, except very controlled. So if there's a problem, the test is immediately stopped before a heart attack can occur. So if you have a negative stress test, that means that your heart can tolerate the stress of surgery. And if you have a positive stress test, then we can usually do other things to make your heart safe for surgery. So what does this mean? Well, usually it involves inserting a cardiac stent inside the artery. The procedure is usually done through the groin without needing major surgery. A balloon is placed in the blockage. The balloon is dilated to open up the blockage, and then a stent is left in to keep it open. So either because you have a negative stress test or because your heart was fixed, you will be at low risk for a heart attack and can undergo a safe kidney transplant. So in general, though, there is an extensive workup before a kidney transplant because we want to make sure the operation is safe for you. And we're really good at it. When I started decades ago, a transplant was considered almost experimental and maybe something of a toss of the dice. Considering that untreated kidney failure results in certain death, the results after transplant are spectacular. Everywhere in the US, transplant recipients routinely survive in the 90s, 90% that is, at 1 year. So not every patient, though, is a candidate for a transplant. And some of you watching this video may be told you're not a candidate for various health reasons, but that is not a death sentence. If you don't qualify for kidney transplant, dialysis is still an amazing option with around 80% of dialysis patients alive that 1 year. This is life-saving, really, especially compared to no alternative at all. And many patients on dialysis lead full and active lives. But transplantation is clearly better, and that difference adds up over the years. Here, the survival of all US patients with kidney failure is depicted. You can see that after 10 years, the survival rate of dialysis goes down markedly. Only 20% of dialysis patients are alive at 10 years. So there is no question that a transplant is the best option. A kidney transplant is the beginning of a miraculous voyage. Someone else's gifted organ breathes new life into you, and we've made huge advances in multiple fields to make this safe and possible. This is going to take some effort and time and won't always be easy, but in the end, an excellent outcome is likely. Thanks for watching this video.